because for people who are over the age of 65, you have a pretty sweet deal. There are giant signs all over the place saying, don't forget to enroll, don't forget to sign up. And I believe people over the age of 65, you can actually sign up online. For those of us who are under 65, well, we're out there in the cold, hard world of the Affordable Care Act. But you enjoy single-payer, socialized, government-run medicine, and you seem to love it, and it works great. Michael Jones is with us, Regional Vice President of United Healthcare. Michael Jones, welcome, Big 550 KTRS.
Good morning. Thank you for having me.
A lot of people do not understand the difference between Medicare and Medicaid. Medicare is for the old, Medicaid is for the poor. That's right? That's a good rule of thumb?
A good rule of thumb. It's a little more complicated than that. Medicare is typically for the aged and the disabled.
Right.
It's a federal program. Medicaid is a state program. Typically women and children and the economically disadvantaged.
Gotcha. And so Medicare open enrollment period started when, goes through when?
Medicare open enrollment started October the 15th, runs through December the 7th.
Okay, what does that mean exactly?
That Medicare open enrollment is the one time of the year where Medicare beneficiaries can go in, evaluate their coverage, their current coverage, ask themselves some basic questions. Does the coverage still meet their needs? Does it fit within their budget? And then, make their selections for the upcoming year. So they can either stay with their existing plan, or if the existing plan isn't meeting their needs, they can select a new plan for the upcoming year.
And who does this, this is for everybody over the age of 65?
This is for everybody over the age of 65 that is Medicare eligible.
Medicare eligible.
Correct.
What does it mean to be Medicare eligible?
So typically it is anybody over 65 and then anybody disabled.
Anybody disabled. But
correct.
If you're
and eligible for Medicare.
If you're 65 and you have a full-time job and you get your insurance through your employer, you don't need Medicare.
You're still eligible for Medicare, though.
But you're still eligible.
Correct.
Oh, that's a nice deal.
You can get Medicare through your employer. A lot of employers these days have Medicare plans because we are seeing there are population, they're working longer.
Right.
And so a lot of employers these days will offer Medicare coverage through their employer-sponsored plans.
Huh. That's interesting. So all we have to do is get to the age of 65, and we've got great health insurance.
All you have to do is get to the age of 65, and you have a great selection of great health insurance.
Huh. Can we sign up online?
You can sign up online. You can also sign up with a licensed agent, face to face.
All right. What's the website online?
It is so for United Healthcare, it's uhcmedicareplans.com,
right,
or Medicare.gov, or you can call 1-800-Medicare to get additional information.
Okay. People love this program? People like the program?
I would say people like the program, but people find it confusing and overwhelming.
Right.
There are a lot of plan options. There's a lot to digest. Medicare is kind of like an alphabet soup, with all of the different parts, parts A through D. We did a study earlier this year. We surveyed 1,000 people.
Michael, can you talk right into the microphone?
Yes,
Everybody wants to hear it. There you go.
We did a study earlier this year. We surveyed 1,000 people. We found that less than half of the respondents could accurately describe the differences between, say, Part A and Part B of Medicare.
That's not good.
No, it's not good. Parts A through D of Medicare. Part A covers kind of your hospital inpatient stays. Part B, your doctor's visits. I'll skip Part C for a second. I'll go down to Part D. Part D covers prescription drugs.
Right.
Part C,
which, by the way, we should mention, Part D is relatively new. The Bush administration made that possible so that all people over the age of 65 got their prescription drugs paid for through Medicare.
Correct. I believe Part D came into effect in 2006.
Right.
So it's like you said, it's relatively new.
Government-run program passed by the Republicans, which people seem to enjoy.
Part C, also known as Medicare Advantage, is offered by private insurers. It often combines, Parts A and B as well as Part D prescription drug coverage. A lot of the Medicare Advantage plans typically offer all of that in one singular plan, oftentimes at a zero premium. Another advantage of Medicare Advantage is oftentimes those plans offer additional benefits like vision, dental, hearing, a fitness membership that aren't offered through through regular Medicare.
A fitness membership?
A fitness membership.
Back up a second. So Medicare Part C?
Medicare Advantage, yes.
Medicare Advantage offers a fitness membership?
Correct. These are plans offered by private insurers,
right,
like United Healthcare. and they include additional benefits that aren't covered in regular Medicare or original Medicare, like a fitness membership through Silver Sneakers.
Okay. Talk to me like I don't know anything, which won't be hard for you to do because I don't know a whole lot to begin with. Somebody turns 65. They want insurance. How much do they pay? What do they pay? What the government pays? How does all that work?
So if you're turning 65 and you're Medicare eligible, or you are already 65 and you are Medicare eligible, I would recommend, sitting down and asking yourself a few questions. First of all, does your existing plan, if you're already a Medicare beneficiary, does your existing plan still meet your current needs?
So, for example, the doctors I need,
Correct.
the care I have.
Yep.
Okay.
Medicare plans change from year to year. So the benefits, just like your insurance through the radio station here,
Right.
changes from year to year.
Sure.
Medicare plans change from year to year. It's really important to sit down and evaluate, is that plan meeting your current needs? And then also what's changing for next year? And will it continue to meet your needs for the next year?
How much does all this cost?
It depends on the plan that you choose,
Right.
and it depends on the type of plan that you choose. There are a lot of options that have, for example, PPO plans, which offers a broader coverage of network physicians. Typically have a premium assigned to it. It can be anywhere from, $25 to $75 a month or more. Or if you enroll in an HMO plan,
Right.
A lot of HMO plans, particularly here in St. Louis, are available at a zero premium to beneficiaries or enrollees.
Okay, so you're telling me, just so I understand this correctly, Medicare recipients pay $25 a month? That's their premium?
That's their premium, depending on the type of plan that they choose.
Or
Correct.
if it's the gold standard plan, it might be as much as $75 a month.
Correct.
And then the rest of it's picked up by the federal government.
Correct.
That's a really good deal.
It is a really good deal.
That's a sweetheart deal. Okay. All right. So a senior 65 pays $25, $50, $75
Or zero.
And all of that is so my diabetes medicine, my glaucoma medicine, my aging, all of that stuff is all covered? I know that's an impossible question to answer. But
it depends on the plan.
Right.
Different plans, the different plans that we referenced have different levels of benefits, different co-pays for going and seeing your doctor or specialist, or
Sure.
different co-pays.
Co-pays being $25, $30, $40.
Correct.
Not
or
like $400.
or if you spend a day or two in the hospital, a
Right.
couple $100, $300 to spend a day or two in the hospital.
Let's say somebody is 64 years old and 360 days old and has cancer and can't buy insurance on the open market. The day they turn 65, do they have a pre-existing condition and Medicare will refuse to insure them?
I believe that they.
Is there such a thing as pre-existing conditions that Medicare will say, sorry, we can't take you?
No.
Pretty good deal. All right, so you're here. Michael Jones is with us, Regional Vice President of United Healthcare. What you're here, what do you want people to know about this?
I want people to know that this is a really important time of the year. Not only are the Cards in the World Series,
Yes, of course.
We're in the middle of football season, but it's also open enrollment, and what we're finding is people find Medicare really confusing and overwhelming. There are so many plan options, so many choices out there, and people aren't taking the time to really sit down and think about their health care coverage for the upcoming year. This is really important stuff. Medicare isn't a one-size-fits-all. As we've already discussed, there are a lot of different plan options out there. It's not a one-size-fits-all. It's really important that you take this time of the year to sit down, evaluate what you have, evaluate what you need. Ask yourself if your health care or your health status has changed.
Mm-hmm.
Ask yourself if your budget has changed. And then take that into consideration when you're looking at your plan choices for the upcoming year. Can you live with either your existing plan, or do you need to make a change so that you are covered and you have a plan that fits you for the upcoming year?
We keep hearing that doctors are not taking Medicare patients because the reimbursement rates are so low.
There is some of that. The Affordable Care Act, we are on the eve now of it going into effect. There have been a lot of changes with respect to the Affordable Care Act. We are seeing not only rising healthcare costs, but we are seeing.
Well, we have to cover the health memberships.
But we are also seeing rate reform as part of the Affordable Care Act, and so it's becoming increasingly more challenging to continue to offer the plans to keep benefits stable, to provide coverage for the Medicare beneficiaries.
So you are seeing some doctors saying thanks, but no thanks. We don't want to be in the Medicare game.
I don't know that I would say that. I would say it's kind of squeezing it, so to speak. Trying to, they're not happy about it.
Right.
But
because the doctors want to charge more, and Medicare is saying, we're only going to give you X and deal with it.
Let's be honest. Medicare is the largest health insurance program in the country. Over 50 million beneficiaries enrolled in it today. The baby boomer generation, 75 million strong. Those people born between 1946 and 1964, 75 million strong. They're aging in at the rate of 10,000 a day for the next decade. So the current system with rising costs, it's not sustainable.
Right.
So we've got to figure out, but with so many people coming in, so many beneficiaries coming into the program, we've got to figure out a way to not only cut costs, but provide better quality care and drive better outcomes in the future.
Cut care and yet also insure 25 million more people. Michael Jones with us. Do you want to stay through the break? Have a couple questions for people on the line.
Sure.
All right, good. Michael Jones with us, Regional Vice President of United Healthcare. Medicare open enrollment started October 15th, runs through December 15th?
December 7th.
December 7th. We're talking about that now, an eye-opening experience. Check that, 920 right now. 314-969-KTRS, 1-888-550-KTRS, or star KTRS. Those are the phone numbers. You have a question, Michael Jones is here for your answer. Come back in just a moment. Now, Fast Eddie. Michael Jones is with us. Regional Vice President of United Healthcare is with us. Medicare open enrollment is underway for people over the age of 65. I guess open enrollment is for people under the age of 65, but our website's not working, and everybody says we should just repeal it. However, no one's really claiming that for people over the age of 65, so socialized semi-government run insurance doing fine and well for people at the age of 65 and older. Michael Jones, as you can imagine, we have quite a few calls on the line we'll get to here in a second. A couple things, though. People say that medical malpractice and all of those things and frivolous lawsuits are driving up health care costs. What do you say to that?
I can't agree or disagree with it.
You have no comment whatsoever.
I have no comment on it.
No one way or the other. Medicare Part D.
Not that I don't have I just can't speak intelligently about it.
Gotcha. Okay. That's never stopped me before from speaking at all about anything. Medicare Part D, when it first came out, the prescription drug plan, which is, I guess, the newest program, if you will, there were a lot of problems with the rollout, weren't there? In terms of people not knowing what to do, seniors not knowing about it, right? It took a while to get Medicare Part D up and running, correct? Or is that incorrect?
I do not recall.
You do not recall. All right. Let's go to the phone. So we got Georgia on line one. Georgia, you're on with Michael Jones, Regional Vice President of the United Healthcare. Go ahead.
Well, I might have misunderstood, but I thought he said that Medicare from Social Security, Medicare in connection with Social Security was only about $25 a month. That is not true. They take it out of your Social Security check, and it is around $100 a month, and it goes up continually.
Okay, Georgia, thanks for the phone call.
Well, that isn't all, though.
Okay.
His pharmacy D, I do have, and I had a lot of trouble with that to start out with. They got to the point they paid for my drugs for a while, and they didn't pay. And I never did get it straightened out. It took me years, but I think they finally gave up because they actually owed me money. And I told them, I said, I've had enough of this. But really, and I'm not against the new Medicare,
sure,
the new health plan and that at all.
Gotcha, Georgia. Thank you for the phone call.
Thank you.
You got it. What is she talking about? Do they take it out of your Social Security check?
Yeah. So Medicare is funded through taxes.
Right.
And when you're Medicare eligible, you still have to pay your Part B premium. Typically, that's taken out of if you're still employed, that's taken out right out of your check or
right.
taxes. Or as she alluded to, it's often taken out of your Social Security benefits that you receive.
Gotcha. So they just take it out before you get it.
Correct.
And her $100, that's just the plan she chose to be on.
It varies. So your Part B premium varies by a lot of different things. To include your income.
Yeah.
So it is. She's about right. It's about $100, maybe slightly more
Right.
per month, depending on your economic circumstances. But I wanted to touch on one thing that she said. What we're talking about with Medicare Advantage are plans that are offered by private insurance companies. And those were the plans that I was referencing that are typically could range from $0 premium a month all the way up to $25 or $75.
This is actually important because you talked about this on the break. You said regular Medicare is one thing, and Medicare Advantage, which is sold by somebody like United Healthcare, is a way to lessen the costs and improve the care. Talk about that for a moment.
Correct. So original Medicare, if you're on original Medicare, typically you have Part A and Part B, and the out-of-pocket expense is about 20%. You can buy a Medicare supplement plan, which you pay a specified premium per month. It's designed to work with original Medicare and cover that 20% out of pocket. Medicare Advantage are plans that are offered by private insurance companies. They combine Parts A and B. They also a lot of times have a Part D or prescription drug benefit that goes with them, in addition to the gym membership that we talked about or additional benefits. The idea being is that private insurers can come in and we can offer these plans in a lot of scenarios, offer these plans to beneficiaries for less out-of-pocket expenses and provide additional benefits in excess of what's offered through original Medicare.
Sounds fantastic. I'm 46 years old. How do I get that plan?
You wait about 19 years, and until you become Medicare eligible.
And so United Healthcare has one of these Medicare Advantage plans here in Missouri that, depending on look at it, maybe it works for you, maybe it doesn't, but that's a way to combine all of them and go from there.
Correct. We have a broad portfolio of products, that cover kind of all of the bases and all the different plan options that we talked about earlier.
All right, good. Here's Marlene. Marlene, you're on line 2. Welcome to KTRS Radio. Marlene?
Oh, yes.
You're on the air. What's your question?
Okay, I was just kind of waiting, but Georgia before me kind of called with the same thing as I did.
Okay.
There is a premium that you pay every month to them that comes out of your Social Security. This year it's going to be like $105. It goes up every year.
Sure.
But that's in addition to whatever plan you want to get.
All right.
I've had Medicare Advantage since I was 72 because I worked up until then, and mine has been great. I've had no problems with it whatsoever.
Marlene, thanks for the phone call. Appreciate it.
Okay.
Let's go to Pat is on line 3. Pat, you're on KTRS Radio.
Yes, Mr. Jones keeps saying you're eligible for Medicare if you're 65 and eligible for Medicare. Who would be 65 and not be eligible?
Correct myself. 65 and older.
Right, 65 and older.
Correct.
But also people younger than 65 who are
disabled
Yep. Are Medicare eligible.
So if you're younger than 65 and disabled and eligible for Medicare.
What constitutes disabled?
I don't know what the exact rules are.
But there's all sorts of regulations and rules.
Correct.
And if you're in a wheelchair, if you've got this, I'm sure it's pretty,
Right.
Defined.
So basically, when I turn 65, I will be eligible for Medicare.
Yes, ma'am.
Okay, that's all I need.
How old are
Just
you now,
waiting.
Pat?
Just waiting. Thank you.
How old are you now, Pat?
I will be 64 next March, and my husband's the same age, and I'm actually on my way to a health insurance meeting. For the two of us right now, we will be paying $800 and I think $80 a month, and it's a $6,000 deductible.
For the both of you, $900.
Well, combined.
Combined, yeah.
Right.
Yeah.
And so we are anxious to get to 65.
Yeah.
So-
Pat, thanks for the phone call. Go
So
ahead.
if I could just comment
Yeah.
on this for a
Yes.
second. Pat is doing exactly the right thing. She is becoming, or she will be Medicare eligible here in another year or so, and she's starting to ask the questions now. That survey that I talked about earlier, one of the things that we found out was, about 67% of the Medicare beneficiaries or eligible population haven't shopped for Medicare or haven't been paying attention to it. My parents are a really good example of that, where they are becoming Medicare eligible. I'm sending them all of this information, really trying to encourage them to start paying attention to this is important stuff.
Right.
I mean, we're talking about you making your selection for the upcoming year. It's important to pay attention to that and make sure that the plan that you select is meeting your needs and fits within your budget.
Let me ask you this question. With the Affordable Care Act, if people don't sign up, there's a fine. Is there a fine if somebody's over the age of 65 and doesn't want to sign up for Medicare?
I don't know the answer to that question.
Aha, I stumped you. And secondly, you have to be the worst salesman in the world if you can't get your own parents to sign up.
Well, they're not Medicare eligible yet.
Okay, all right, fair enough. Okay,
but it's important, and the caller was doing exactly the right thing, asking the questions early. I'll tell you, every year I sit down with my grandparents. They live down in Florida. I sit down with my grandparents, and we sit down and we review their existing coverage. It's like pulling teeth.
Mm-hmm.
But we sit down, we review their existing coverage, talk about what's changing for them, and then look at the plans that are offered for the next year, and we make the selection for them. I've been badgering my parents to start paying attention to this. This year, my mom called the head of open enrollment. She said, and asking about, Medicare plans for my grandparents down in Florida. And so now she's starting to pay attention to this.
So if I have a plan with, say, United Healthcare, and I'm over 65, and that's now in this open period, I can ask you guys a bunch of questions. You might say, boy, you might want to look at Medicare Advantage. You might want to look at this. You might want to look at that. Because I'm in this open enrollment. Once December 7th comes, then I'm locked in for another year.
Correct.
Okay. Let's go to Lester is on line 2. Lester, you're on with Mike Jones, who is the Regional Vice President of United Healthcare.
Hello.
Hello, Lester. You're on the air. Go ahead.
Thank you. You might point out to your guests that some of your callers already pointed this out. Medicare people pay over $105 a month out of their Social Security check for Medicare premiums. Then on top of that, they have to buy a Medicare supplement plan if they're not in an HMO, which can run up to $200 or more a month for that. And then one little nasty secret that you haven't talked about is that there are pre-existing conditions set by these insurance companies for Medicare supplemental plans.
All right, Lester, you have a lot of questions here. Hold on a second. First of all, why would somebody have to buy a Medicare supplement plan?
So as we talked about before, Medicare supplement is designed to work with original Medicare. And so that 20% that we talked about, those out-of-pocket expenses,
right?
Medicare supplement plan is designed to sit on top of original Medicare, and then cover the cost of that, essentially that 20% that's out of pocket.
But if you moved from traditional regular Medicare to Medicare Advantage, you wouldn't necessarily need this Medicare supplement.
Correct.
Gotcha. And so you're buying the supplement to cover the 20% cost. So these people who are calling saying, and this is actually important. Let me see if I have this right. These people who are calling who are saying, look, you're taking $100 out of my Social Security check, and then I have to pay more. They're in traditional Medicare. Sounds like.
Sounds like, yeah.
And you're saying if these people moved over with this open enrollment, were to call and say, hey, tell me about Medicare Advantage, their fee would go down approximately or stay the same, comparable, but they wouldn't need this Medicare supplement, would they?
Let me clarify for a bit. So the premium that the callers are talking about,
right?
That's the tax portion of it,
right?
For lack of a better term,
That's the fee they pay.
Yep, that's taken out of their Social Security, or it's taken out of their check if they're still working.
Right.
That's just to have to be eligible for original Medicare, or just to have access to the plan.
Right.
Beneficiaries can select either to stay on original Medicare.
Mm-hmm.
They can, if they want to stay on original Medicare, but they want to buy a Medicare supplement plan to cover those out-of-pocket expenses, that 20% we talked about, they can do that. Medicare supplement, as the previous caller outlined, Medicare supplement plans, typically the premium on top of what's taken out of Social Security.
Right.
The premium is a couple $100s a month, depending on the plan that they choose. Or the third option, they can go to a Medicare Advantage plan underwritten by a private insurer company.
What's the benefit of staying with a traditional Medicare plan, paying 20% out of pocket, as opposed to Medicare Advantage?
I think it depends on personal preference. It depends. We said before that Medicare is not a one-size-fits-all. So, for example, a relatively healthy person, that doesn't see the doctor often, maybe they choose, they've got a really good Medicare Advantage plan, here in St. Louis, and
Right.
they choose to go on a Medicare Advantage plan. My grandparents, on the other hand, my grandparents have chosen, they figured out that original Medicare is right for them, and then they buy a Medicare supplement plan to sit on top of that to cover all of those out-of-pocket expenses.
So
that they
your
pay through.
point in this is ask questions and ask whether Medicare Advantage works for you or your traditional Medicare works for you.
Exactly. It is not a one-size-fits-all. Ask those questions and make sure that you get into a plan that's right for you.
I want to ask him about, he brought up some pre-existing conditions. I want to ask about that. Michael Jones, can you hold through the break?
Sure.
Quick check. Back in a moment. Big 550. 941 here. Big 550 KTRS. The question about pre-existing conditions, Michael Jones, Regional Vice President of United Healthcare. When we were talking on the break, and I just wanted to bring up pre-existing conditions. What did you tell me on the break about pre-existing conditions?
Pre-existing conditions, the only one that's that we're allowed to ask by the Center for Medicaid and Medicare Services is regarding end-stage renal disease. And my understanding is that there is a special plan or special treatment for those with end-stage renal disease. Typically, with Medicare Advantage plans, we are prohibited from asking, we private insurers like United Healthcare, we're prohibited from asking any health-related questions or any pre-existing condition questions. It's guaranteed issue with the exception of that end-stage renal disease that we talked about.
It seems like what I'm taking from this conversation is that you would say that if you have traditional Medicare today, you have an opportunity between now and December 7th to call and ask questions about whether or not you want to switch from traditional Medicare to Medicare Advantage and take a look and see if that's a better option for you.
Not only if you are on original Medicare, but if you are already on an existing Medicare Advantage plan, you have the opportunity between October the 15th and December the 7th to review your plan options and then, either stay with your current plan or, choose a new plan or choose a Medicare Advantage plan prior to December the 7th for 2014.
When you say a new plan, do you mean a new insurance company?
Correct.
Okay, so
Yep.
I'm at insurance company A. I can go to insurance company B tomorrow.
Yep.
And
You're with insurance company A. The plan isn't meeting your needs.
So I can call up insurance company A and say, tell me about your Medicare Advantage plan.
That's correct.
And then I can call you up and I can say, tell me about your Medicare Advantage plan.
That's correct.
And it's apples to apples.
You can sit down, you can do a comparison, ask yourself those questions that we talked about earlier, and then make a selection that's right for you.
Let's go to Jim is on line 6. Jim, you're on the Big 550 KTRS.
Good morning, gentlemen. I'm a member of United Healthcare AARP Medicare Complete. I had a knee replacement a year and a half ago, and Memorial Hospital is where I went in Belleville. It's where my orthopedic surgeon is. Now I can't see either of them because they won't take United Healthcare at Memorial Hospital in Belleville. Would you explain it? I'll hang up, please.
Thank you very much, Jim. Go ahead.
He's exactly right. I can't speak to the orthopedic surgeon that he's referencing. He didn't give a name, but yes, Memorial Belleville. We were in contract negotiations with them earlier this year. It didn't work out, and so Memorial Belleville went out of network effective July 1st.
So they're not part of your program, in other words.
They are not part of our network for our Medicare Advantage plans in the Metro St. Louis area.
Forgive the analogy, but it's almost like cable companies and TV channels, where cable providers argue with certain channels, and channels want too much money, and so some Charter drops a channel, Uverse picks it up, Uverse drops one, AT&T or DirecTV picks it up. Is that a similar analogy to insurance companies and hospitals and doctors?
I wouldn't say that it's accurate. I would look at it this way, particularly with the Affordable Care Act. We are seeing a strain on revenue. We're seeing rate reform or rate cuts compiled with sequestration, and then you factor in the rising care of healthcare costs. And so we have to continue to be able to provide coverage to our members, and do so in a way that's affordable and that we're driving quality outcomes. And that forces us to make some tough decisions about with respect to our network, because That's how we manage or try to provide care to that population is through the network of doctors and hospitals that we've partnered with.
Michael Jones is with us, Regional Vice President of United Healthcare. How much are the death panels in Medicare?
I'm sorry?
How much are the death panels? Are the death panels in Medicare? There are no death panels.
I don't know what you're talking about.
Okay, remember the joke during the Affordable Care Act when they said that there were death panels and they were going to have these morbid death panels? You don't remember that? No. Okay. That was a joke. It didn't go over very well. It worked better in rehearsal. Let's go to Bob is on line 4. Bob, you're on the Big 550 KTRS. Bob, you're on the air. Bob, are you there? Bob's gone. Let's go to Barbara's on line 5. Barbara, you're on the Big 550 KTRS radio.
Hello.
Hi.
Hi. My questions are, I'm 67 and my daughter is multiply disabled. I care for her at home. I don't know why I can't get any kind of insurance to help cover in-home aid service since I had cancer and I have problems now myself, or adult daycare service so I can have a break and drop her off and do what I need to do to keep our family going here at home.
Barbara,
It would be a wonderful thing for a lot of us aging people.
Barbara, thanks for the phone call. It sounds to me like that her child would be part of Medicare, right? Because she's disabled.
Potentially, yeah.
Yeah. All right. Steve, let's try to get one more here. Steve, you are on line 1 there in the Big 550 KTRS.
Turning 65 in 2016. Birthday's in April. If the enrollment's open from October to whenever, do I enlist before my birth date or after my birthday?
Good question.
Yeah, great question. So, Steve.
Hold on a second. It's a good question. A great question. I'll go straight to Steve's head. So it's just a
You got
good
that
question.
right, buddy.
Thanks, Steve.
So Steve has basically a 7-month window in which to enroll. He can enroll 1 month before his 65th birthday. He can enroll. He can enroll the month of his 65th birthday, and then he can enroll. I believe it is up to 3 months after his 65th birthday.
So even though it's an open enrollment, that's for existing people, but for new hire or new entries, you can sign up if you become 65 in February. You can sign up in February.
Yeah. So, and I'm sorry, let me clarify that.
Yeah.
Steve can enroll up to 3 months prior to his 65th birthday.
Okay.
He can enroll the month of his 65th birthday and then 3 months after his 65th birthday.
Gotcha.
So I apologize for
Gotcha. So even though the open enrollment is in October.
Correct. He's aging in. He has the window to enroll, that 7-month window that we talked about.
All right. Michael Jones, a lot of information and a lot of good information has been disseminated. I hope people were able to partake in some of it. If people have questions of you and or going forward, where is a great resource people can go?
So there are a lot of resources that are available. We've got 2 Medicare stores open here in the St. Louis area, South County Mall, and up in Ferguson at the crossings at Halls Ferry, where they can go in and speak to a licensed United Healthcare agent, ask questions, get information, enroll right there if they so choose. They could also go to UnitedHealthCarePlans.com. They could call 855-874-6290. Medicare.gov or 1-800-Medicare is another good resource. Or locally, talk to your physician, talk to your pharmacist, talk to the area on aging, talk to the state health insurance plan program. All of those are great resources to get additional information about Medicare.
That is the Regional Vice President of United Healthcare, Michael Jones. I got to tell you, fascinating conversation, so thank you very much.
Thank you for having me.
You got it. 9:50 here on the Big 550 KT.